Well, I mean, I think I'd like to highlight three, Jim.
Okay.
But in brief, it's the first one is using design thinking in terms of figuring out what are the outcomes that we're trying to achieve and building that in first. Our secretary, Bob McDonald's, really big on design thinking and has infused that concept into our organization.
I like that.
And I think that the examples I gave earlier with My Healthy Vet, the patient portal, and the Joint Legacy Viewer, their sort of organic growth and catching on shows that if you build health IT products that actually solve issues, for My Healthy Vet, it's for patients,
Right.
but for Joint Legacy Viewer, it's for clinicians, those are going to be the successful products. Second thing, I think, in terms of lessons learned is it's important to build in key performance indicators early, right at the outset. So both the supported organization, the healthcare organization, and the IT organization know exactly what the expected outcome is supposed to be for that system. I remember I was back in 2006 and early 2007. I was at Centers for Medicare and Medicaid Services, and I was the acting regional administrator for Region 10, the Seattle region. And this was the second year of Medicare, the open enrollment season for Medicare Part D, the prescription drug program. And our caseworkers got information from their IT system that really didn't help them help our customers very well.
Yeah.
And so I called back to the IT organization, because I've been back and forth both on the business side and the IT side, and I said, you know, this system that we have really isn't helping us achieve the outcomes that we're wanting to do. And I remember the person from IT coming on the phone saying, well, we built it as designed.
Yeah.
And it's like, well, maybe, and it wasn't the IT's fault, and that wasn't maybe the business, but there was a failure of communication at the outset to figure out, well, what is the outcome that we want in the beginning? And then
may have not had the right players, and you need to visualize outcomes.
What is it at the end game? What do you want to accomplish? And getting those key performance indicators up front is important. And then I think the third thing is humility, in that over time we build processes. We had a project management accountability system in VA that made sure that we didn't go off the rails in some of our projects. But over time, that sort of grew and grew and grew, and it became so cumbersome that it was hard to get projects done. So we've pruned that now this year under Ms. Laverne Council's leadership, and we have a new process where instead of having 57 artifacts to move a product through the pipeline, there's only 8.
Okay.
Instead of 5 formal reviews that take a lot of effort, there's only 2. And so so I think that it's important for all organizations to look, and really all of us as individuals, to look internally and say, well, does this still make sense?
Yeah.
It worked at one time, but can we do better now?
Right.